I'm Carole Taylor. On this edition of Journal, we explore the dismal state of our healthcare system. Or are we even allowed to talk about it? Is this topic untouchable by either debate or reform? You know, as a country, we've been bullied into silence, even in the face of people dying on wait lists. 6.5 million people in Canada without a family doctor, and over 800,000 of those in this province. And now some cancer patients in BC are being sent to the United States paid for by our government because we can't give them the treatment they desperately need here at home. As well, some ERs around the province are closed intermittently because of a lack of doctors and/or nurses. And that leaves those residents no option but to drive long distances for emergency care. Yet, if you dare suggest that something's wrong with this picture, people like Dr. Brian Day are branded as wanting to destroy Medicare rather than improve it. A conversation stopper is when a speaker is accused of wanting the bad old American system. Remember, that's the system that is currently providing care for British Columbians in need. It's time to take a deep breath and admit our healthcare system is not the best in the world, far from it, and is in need of reform. The man who has taken on this issue is Brian Day, a Vancouver orthopedic surgeon, health researcher, and past president of the Canadian Medical Association. His 14-year lawsuit against the province's Medical Services Commission went to the Supreme Court of Canada, which refused to hear the case, despite ruling on a similar Quebec case in 2005. Well, the weaknesses in our healthcare system did not go away just because the lawsuit did. So where do we go from here? Dr. Brian Day joins me right after this break. We're back with Dr. Brian Day. Brian, what was it that you were either seeing in your own practice or in medicine generally that took you to the courts?
In the mid to early 90s, we built a clinic that was smack in the middle of a 10-year rule of an NDP government. And then things had been going fine in the earlier years, but what happened in the public system in British Columbia and the rest of Canada was our operating time was cut by the hospital authorities from, we had an average of 22 hours a week of operating time allocated to us as surgeons. And that was progressively, year by year, cut down to 5 hours a week. And yet we all had hundreds, like I had 400 patients waiting to get into hospital. And it was just very frustrating. And then what happened was there was a government came in that decided to make it difficult for us to operate, even though we, as I said, we opened under an NDP government with their support, that we had to go to court to defend our position where otherwise our patients were not going to get treated.
So tell me about some of your patients. Can you give me examples of what was happening?
So, the patients in my practice were orthopedic patients, but what happened was we were faced with patients contacting us and mothers of patients contacting us. I mean, one was a 14, 15-year-old boy who had waited a couple of years for a spine operation and ended up paralyzed for life. Another was a lady an elderly lady who had lung cancer with metastases and was told she hurt her knee playing golf. I mean, she was still able to play golf and walk her dog. And she was told it was going to be almost a year to get into hospital. Well, her life expectancy was only a year. And these are the kinds of patients. And then there were children, another young child, a teenager, who was potentially getting a sports scholarship to university to play soccer. And she hurt her knee and was told, I'm sorry, you can't get your surgery in time to even consider getting this scholarship. And her parents weren't wealthy, so she was being denied a chance of an education, a whole life-changing thing. Patients like that.
There was a story on the front page of the paper not long ago, a woman out of Parksville, and she managed with some delays to actually get the cancer surgery and was told that she would immediately start preventative chemo. And of course, it wasn't available, and she waited and waited and waited, and by the time it was available, of course, the cancer had spread.
Yes. Well, the unfortunate thing about Canada is those those who are least powerful and get the worst access. So the lower socioeconomic groups suffer the most. And we know that if you're the premier and you get cancer, you get treated right away, whatever the treatment is, in your hometown. And in the reality is, we're not all premiers, and that doesn't happen to ordinary Canadians. They're suffering and dying on wait lists, and the evidence is clear. The evidence was clear in our trial that patients are suffering and dying on wait lists. The latest stats show that over 35,000 people died in 1 year on wait lists without getting treated. It's very, one of the worst examples I like to quote is the so-called Angelina Jolie gene, where it's predicted if you have this gene that you're going to develop breast cancer. And in BC alone, the studies have been published that every year, 6 young women who have that gene positive and are waiting for the surgery to have the breast removed to save their lives, 6 develop breast cancer who were known not to have breast cancer previously. Well, how can we accept this? And the point being, it's illegal for them to do anything about it. It's illegal for them to use insurance or private insurance or public insurance or anything to do anything about it. They just have to sit there and develop cancer. And to me, that's tragic and indefensible.
And so it's absolutely accurate to say people in Canada are dying on the wait list.
Oh, absolutely, yes. And it's getting worse. I mean, when we finished our lawsuit, which was 2020, the trial ended. But since then, things have become much, much worse. As you mentioned, people are literally being turned away from emergency departments or not even making it there and dying. And this is a health system that some people call wonderful, but if you look at the objective criteria that groups like the Commonwealth Fund do, of 10 developed countries with universal health care, Canada is ranked 10th in access, 10th in equity and fairness. And as I said, the tragic thing too is that the lower socioeconomic groups have the worst access and the worst outcomes in Canada.
And you mentioned the Premier, for instance, is able to have cancer taken care of. But there are exceptions under Medicare. I think some people think, oh, well, it's universal care for everybody. Everybody's treated the same, and off you go. But in fact, tell me what exceptions there are, people who can go to the front of the line.
Well, the interesting thing is any federal employee, so I mean, this is ironic, but the very judges that was sitting in a decision-making capacity during our trial are exempt from the rules that we were trying to have broken for others. In other words, the rules outlawing using their private extended health insurance or federal funding, they are exempt from them. So judges are allowed to use private clinics and access private care using private funds. So are federal prisoners. So are Canadian Armed Forces, workers' compensation patients. And of course, to me, fairly outrageously, if you like, residents of other provinces can come here and they have rights in British Columbia that the law denies to British Columbian residents, which to me is bizarre. Like, it's bizarre that someone from Alberta or Saskatchewan or Newfoundland can come here and have access to immediate health care, but that's illegal for a resident.
So to make that clear, if I want to come to your clinic, I can't do that. But an Albertan can fly to Vancouver and they get in at the front of the line in your clinic.
Yes.
And the other side, I can go to Alberta and get into one of their clinics, but I can't go to one in BC.
Yes, this is, so a few months ago I was operating on 5 Albertans in British Columbia, and a colleague in Alberta was operating on 6 British Columbians. That's how bizarre the system is. We don't have a health system. In Canada we have 14 health systems, and none of them is working well. And we don't have a universal system. I mean, to me, a health system that doesn't cover medications, like the diagnosis of your infection is covered, but the treatment isn't. It doesn't cover an ambulance when you break a leg and are lying on the roadside. That's private. You need private insurance for that. And things like that. Dentistry, people get an abscess in a wisdom tooth that goes through to the brain. It's covered once it goes through to the brain, but not when it's an abscess in the tooth. These are all covered in other universal systems.
And you mentioned workers' compensation. So if I get hurt on the job, then I'm to the front of the line. The same worker, I'm at home and I trip and I have an accident, I'm the back of the line.
Exactly. But workers' compensation they operate as a private insurance company, because a lot of people don't realize it. Workers' compensation is completely funded by employer premiums. There is no government tax money going to workers' comp. So this was in evidence in our trial. The judge ignored it, but in our trial, oh, by the way, the judge in our trial had been treated at a private clinic.
On that note, we're going to take a little break and continue this conversation. Just back in a moment. Welcome back. You were saying that the judge who was presiding over your case actually had been treated at a private clinic.
Yes, actually, prior to the trial proceedings, he disclosed that he had been treated. Actually, he disclosed that he'd been treated at our clinic, but I knew he hadn't. I knew where he had been treated, and the point is, he was government funded. So, I personally have received funding from the federal government in payment for judges that I've treated at our clinic. And, this is the hypocrisy that exists in our system. In 1991, I wrote an editorial in the Vancouver Sun called The Hypocritical Oath. And it was about politicians and others jumping the queue themselves, a queue that they forced upon others. And this happens in many areas, but when it happens in healthcare, I just don't think it's acceptable.
How did we get here? How did this system become such a mess? I know that in the 90s there was a lot of discussion about this.
Well, I think it started off in the 60s with the idea of universal healthcare. And I think you have to remember that's 60 years ago. So technologies weren't the same. There were no lung transplants. There were no the complex procedures that are done now in surgery, the minimally invasive surgeries that we do now, and also our aging population. So a system that worked well in the 60s, and actually even in the early 70s, when I came to Canada, there were no wait lists. Like if we saw a patient with hobbling around, we could get them into hospital within days. But the health system in Canada did not evolve subsequent to that, and yet the health system has not kept pace with healthcare. That healthcare now we can do a lot of things. We can treat a lot of diseases. We have many, many more options in treatment. We have expensive drugs, and it wasn't the same in the 60s. And notwithstanding that, when Tommy Douglas introduced, the concept of the Saskatchewan Insurance Act in '61 in Saskatchewan, he never intended to outlaw private options. In fact, he said there should be room for individuals to help support themselves. And I think, to me, this is the most significant thing, is that there are almost 200 countries on the planet Earth, there is only one country where private health insurance is illegal, and we live in it. And to me, that is bizarre. And I can tell you a story. I went to, I was invited, because the world, if you like, didn't believe this. I was invited to speak at a convention in Budapest a few years ago. And there were representatives from about 150 countries there, including, authoritarian countries, communist countries. And I gave my opening talk and described, what we've been through, what the system was. And a delegation from Beijing, China came up to me afterwards, and one young man who spoke fluent English, he said, this could never happen in our country. We do not accept the government controls your bodily health in the way your country does. And I think that that is the reality. The government in Canada believes it's in charge of our bodies.
And complicating all of this, of course, in the 90s, I remember an academic saying very vocally, and he got public support, saying, well, the reason our healthcare costs are too high is we've got too many doctors, so let's cut back.
Yes, and that's right. So the NDP government of the 90s oversaw a commission called the Seaton Commission, and a fellow called Robert Evans was influenced by his colleagues Bera and Stoddard and Bera, and their conclusion as quotes economists, health economists, was that too many doctors and nurses were treating too many patients, and that the best way to solve that is to cut back on the number of doctors and nurses and to stop immigrant doctors from coming into the country. And they did it.
And they also stopped building hospitals.
And yes, and so yes, in the decade following that, not a single hospital bed was built in Canada. And so we're now I think 29th or 31st in the world in the number of hospital beds per population. And we saw the impact of that during COVID, where people were in corridors and infecting each other, that we are now, we used to be in the top world top levels of hospital beds per population, and now we're around about 29th or 30th, despite being the most expensive universal health system in the world. Only the US spends more than we do on healthcare.
What about doctors per population?
Well, today we rank 69th in the world in doctors per population. When I came to Canada, we were between second and fourth in the world.
And so that, of course, really denigrates the system, and then you've got to do catch-up. So if you were in a place that you could do something about this, what would be your first steps? So
there are several steps. Number one, I think this is generic. If somebody else is doing something better than you and you're spending more than them, perhaps it's worth a look at what they're doing. And so if you look at other countries, there are a few things. Number one, of course, we have a state-run monopoly in the funding and delivery of healthcare, and monopolies don't serve consumers well. So clearly, we went to court on this. We think Canada should not be the only country on the planet where private health insurance is illegal. It is, private health insurance isn't illegal for nurses, for physiotherapists and antibiotics and drugs and dentistry and an ambulance, but we've arbitrarily said that for other things it is. So we do have private insurance in Canada. The second thing that Canada is unique in is in fully global budgets being applied to our hospitals. So if you go to hospital in Europe, in France or Holland or Belgium or Sweden or Germany, the patient brings to the hospital government funding in their public system. So for instance, I'm just making up these figures, but suppose you go for a hip replacement in Germany, the public hospital gets, say, $15,000 from the state insurance, from the government insurance. In Canada, when the patient goes to a hospital, they're using up the annual fixed budget.
So they come as a cost.
Yes, so every patient in Canada going to a public hospital is a cost item. And so if you're the chief financial officer, the last thing you want is patients. The same applies in the emergency department. And you go to an emergency department in Germany and you bring revenue to the center. So that's number one. Number two, other countries have things called a care guarantee. So if you're waiting beyond a certain number of months, which the data shows is harmful, then the government has to pay for you out of their tax dollars. It's not their money, it's tax dollars. They have to pay for you to go and get treatment anywhere else you choose, once you've exceeded the maximum acceptable safe time. And that data is all there. It was in our trial. It was hidden from the public. We had to bring government witnesses to get that evidence out. But they have the data on the maximum safe time for pretty well everything. And then the other thing is as I said, that we have to have some competition for the public system. So I think with those things, things will improve. You know, right now, for instance, I have a visiting fellow from an orthopedic surgeon from Germany spending time with me. I asked him just off the cuff the other day, how long, you know, because they have 90% public, 10% private. I said, how long would you wait for a hip or knee replacement in Germany? He said, oh, a long time if you're in the public system. I said, how long? 6 or 7 weeks.
With that thought, we have to leave it. But Brian, I hope you don't give up the fight. I hope you keep fighting for all of us. Thank you. Dr. Brian Day. For sure, at its best, our healthcare system works magnificently. But for many, it just does not. You don't need me to retell the stories of patients that have filled the front pages of our papers for too long. Waits to see a specialist, waits for MRIs, waits for surgery, waits for chemo or radiation. Waits that sometimes mean dying while waiting. It should be okay to ask, how can we improve our system? Let me know your thoughts on our YouTube site. Till next time, I'm Carole Taylor.